Uh, بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسوله الكريم وعلى آله وصحبه ومن تبعهم بإحسان إلى يوم الدين. Dear brothers and sisters and community members, all praises are due to Allah. We praise Him and we seek His help and we seek His guidance and we seek His forgiveness and we seek refuge in Allah from all bad deeds and we seek refuge in Allah from all evils. Whomever Allah guides, no one can misguide. And whomever Allah send astray, no one can guide. We have a greeting to you today. Assalamu alaikum wa rahmatullahi wa barakatuh. And we ask Allah subhanahu wa ta'ala to accept our siyam and our qiyam and all our good deeds. Allahumma ameen. Today is your program again, COVID-19 updates. And this is an ECNA program run by the ECNA VA Masjid. You can follow us on Facebook and YouTube and also on our website, ICNA VA. We have with us today again Dr. Zubair May. As you all know, he is MD, MPH, and he's a community health specialist from the Fairfax County Health Department. And he's with us on his public health outreach to the Muslim community. And he's going to give us updates. As we all know, the numbers are climbing every week. And so far we have 3.5 million globally. Almost 250,000 have died from this. In the United States, we have about 1,156,000 and 67 plus death in our country. And in Virginia, the total cases 17,731, and I'll let Dr. Zubair to add to us and give us his input today. Please.
Assalamu alaikum wa rahmatullahi wa barakatuh. Hello, everyone. It's nice to be with everyone again. So in Fairfax County, we see now we have a total number of cases, 4,101, 693 hospitalizations, and 157 deaths due to COVID-19 in Fairfax County. So the number of cases and deaths continues to increase in Fairfax County. But again, what we want to remind people is that we're starting to see that curve bend, so all that talk about flattening the curve is indeed happening in Fairfax County. We're starting to see that the rate of increase of cases and death is starting to bend. And so this is showing that the mitigation efforts, such as social distancing, staying at home, and so forth, is having a positive impact. So we need people to keep on doing those things. Now let's go on to some of the new updates or information that we learned this past week relating to COVID-19. Some information regarding something called Kawasaki disease and COVID-19. So the World Health Organization is now actively investigating a possible link between something called Kawasaki disease and COVID-19. So what is Kawasaki disease? Kawasaki disease is a condition where the blood vessels become inflamed. So inflammation of blood vessels, particularly in infants and young children. And it's characterized by a rash and fever. You can even have peeling of the skin. It can also affect the lymph nodes, skin, mucous membranes like inside the mouth. So want to emphasize that this link between COVID-19 and Kawasaki disease has not definitively been confirmed. They're investigating this because there have been about 100 or so reports of this in at least 6 countries with doctors in the UK, France, Italy, Spain, Switzerland, and the United States. They have reported that this condition with kids who have been tested positive for coronavirus. Now, of course, there are also kids who get this who are then tested negative for coronavirus. So it's something that they're going to investigate. And it could be that this similarity to Kawasaki syndrome is being seen in some kids who have COVID-19. It could be because, again, because of the inflammatory effects of the virus itself. We've talked about in previous weeks how this virus impacts the body, namely that it causes inflammation in some individuals. So it could be that this is what's going on, or it could be something else. So this warrants further investigation, and they'll be, of course, looking into that more closely. In previous weeks, we've talked about how some people with underlying conditions are more at risk for severe disease and death due to COVID-19. I think we briefly talked about cancer, but now there are studies that are specifically showing that people who have blood cancers or lung cancer, that they are at much greater risk of severe disease and death due to COVID-19. There was a study that was done in collaboration from China, Singapore, and the United States. And they found that cancer patients who had COVID-19 had nearly a 3-fold death rate from the virus than the rest of the population. So it doesn't come as a great surprise, but it just confirms what we've been talking about, that people with underlying health conditions, including cancer, are more at risk for severe illness and death due to COVID-19. Of course, the big news this past week was the drug remdesivir. So if you recall from previous weeks, I think it was 2 or 3 weeks ago, I had mentioned this drug remdesivir, and that it was showing some promise in some trials. And so the big news this week was that there was a very large study that was done, a clinical study, a powerful study. It showed clear results. It has not yet been peer reviewed. I think that's important to mention. But the evidence from this study was so compelling that the FDA rushed emergency authorization for the use of this drug for COVID-19 patients in the hospital. I want to emphasize that this drug remdesivir, it was shown in this study that it reduced the average hospital stay of COVID-19 patients in the hospital from 15 days to 11 days. So people recovered faster using this drug remdesivir compared to a control group that did not use remdesivir. And again, they found that the results were so compelling that the FDA has now done this emergency authorization for remdesivir. I want to emphasize that this drug is for the sickest patients who have COVID-19 and who are in the hospital. And so they're not using this drug for everyone. They're using it for this specific situation, that you have COVID-19, you're in the hospital, and your situation is very bad. Maybe you're on a ventilator and you're struggling. And so then they're going to be giving remdesivir as part of this FDA emergency authorization. I also want to emphasize or point out here that this does not mean that this is a permanent FDA approval like you see with other drugs, like the FDA stamps their approval for a drug. This is emergency authorization. So let's see how this goes. They're going to, of course, be looking at this very closely. But what we can say is that we can say that it does look like remdesivir is the first part of our coronavirus toolkit. And they're going to be, inshallah, hopefully building upon this and looking at other ways in which coronavirus can be treated, maybe using remdesivir in addition to some other drug that gets developed, or maybe some other drug is even more effective. But for those people who might be wondering, what's the big deal about shortening a hospital stay from 15 days to 11 days? It's only a 4-day difference, but actually that makes a big difference. And it can make a big difference in a patient's outcome as well. As we know, the longer someone is on a ventilator, the greater their chance of dying in the hospital. The longer you're in the ICU, there are worse outcomes. So if we can shorten a person's time in the hospital and on a ventilator in the ICU, in general, that's good for a person's prognosis and their overall health in the future as well. So, it's good. This study is good, and this drug remdesivir looks like it has some sort of ability to fight the virus. Remember, we mentioned this a few weeks ago because we know that remdesivir has some ability to prevent the virus from copying itself inside human cells. And I was somewhat hopeful about this drug, and it looks like there's more reason to be hopeful about it. But also want to emphasize at the same time, this by no means is a cure for coronavirus in general. It's not some sort of prevention, but rather it's a drug that right now has been authorized for emergency use in patients who are the sickest due to COVID-19 in the hospital. Another study from China has shown that men are 2.5 times more likely to get severe disease and die because of COVID-19 compared to women. If you've been paying attention again to the updates from the past weeks, I've been talking about this again and again. So the body of evidence is growing that men are suffering from COVID-19 more than women. It doesn't mean that women don't get infected. They're just as likely to get infected as men, but for whatever reason, and there are several reasons that have been theorized, and we discussed some of them in previous weeks, whatever the reason is, men seem to be more susceptible to severe illness and death due to COVID-19 compared to women. And of course, this is going to be more and more investigated. According to some new serological data, which is provisional, but it suggests that coronavirus infections greatly outnumber confirmed COVID-19 cases, potentially by a factor of 10 or more. What that means is that whatever the case count is now for COVID-19, it looks like it's likely that the actual number of people who have been affected by the virus is much, much greater, perhaps by a factor of 10 or more. Again, not a huge surprise, but again, studies are showing that our assumptions are perhaps true, that there are many, many more people infected than the official confirmed number of cases. How about the death rate, or the numbers, I should say, the numbers of dead due to COVID-19? Is it an accurate count or not? According to some public health experts, they are now saying that perhaps the number of dead due to COVID-19 has been underreported or undercounted. There are a couple of reasons for this. One is that the number of people who are counted as officially dying due to COVID-19, those numbers are taken from hospitals, but some people die outside of hospitals, like in nursing homes and so forth, and perhaps those people are not being counted. If they're not being counted, then of course the number of deaths due to COVID-19 is even higher than the official count. Another thing to consider is pneumonia. We know that COVID-19 can cause pneumonia. And what's happening is that in some places in the United States, perhaps someone dies, and on the death certificate they put down the cause of death as pneumonia. And they may be doing that because maybe the patient wasn't confirmed to have coronavirus, but they were confirmed to have pneumonia, so they put down the official cause of death as pneumonia. But it's interesting to note that in a typical year, between the last week of March and the 2 first weeks in April, how many people die of pneumonia? Usually in the United States, it's about 11,300. However, this year, between March 22nd and April 11th, 22,200 Americans died of pneumonia. So about double the number of Americans died of pneumonia in the same time period that we compared to previous years. So it very well could be that at least some of those people who died of pneumonia, that pneumonia was actually caused by coronavirus, and that was that would be listed as a cause of death. So it wouldn't surprise me that that later on, as numbers are adjusted, that we might see that the number of cases, or number of deaths due to COVID-19 is greater than what is currently being reported. Now, yesterday was May 1st, and there have been a bunch of states in the United States that are now gradually reopening. But it is important to note that yesterday was the deadliest day due to this pandemic in the United States. Over 2,900 people died to COVID-19 in a 24-hour period in the United States, marking the deadliest day yet in the United States due to this pandemic. Now, a lot of people are, of course, asking, How long are we going to deal with this? I've been asked this, of course, in previous weeks as well. Well, now some public health experts are saying that this pandemic could be around for another 18 to 24 months. Um, it's now believed that herd immunity cannot be achieved unless 70% of the population is protected against this virus, either because they recovered from coronavirus or they get vaccinated, which of course there's no vaccine yet. Now, herd immunity, of course, refers to the concept whereby if enough people in the community are protected against a disease, then the virus doesn't have much ability to be transmitted. And so and it depends. Every disease has a percentage in order for herd immunity to be achieved. And for this virus, coronavirus, they are estimating that about 70% of the population should be protected, either, again, because they previously got sick and they recovered, or they've been vaccinated, like in the future if there's a vaccine. Now, there's also been talk, of course, about multiple waves of disease, where I just mentioned at the outset that the curve is flattening or bending here in Fairfax County, but it doesn't mean that this will be the end of it. Many experts are predicting that there will be another wave of disease in the fall and winter. Why is that? There's a couple of reasons for that. One is because in previous pandemics, like the 1918 Spanish flu, we saw multiple waves of disease. And of particular interest and note is that the second wave was worse than the first wave. So one reason why experts are anticipating another wave of disease in the fall and winter is because of history, because we've seen this happen before. Another thing is coronaviruses, and remember, this is just the latest in the coronavirus family. There are other coronaviruses, and what we see with coronaviruses, especially the coronaviruses that cause the common cold, they reappear in greater numbers, in greater number of cases in the fall and winter. So that's another reason why we are perhaps anticipating that there's going to be another wave of disease in the fall and winter. And then just overall in the fall and winter, this is not directly related to coronavirus, but it affects the population nonetheless, which is that in the fall and winter, we see that's the flu season. And the reason we see a greater number of cases of flu in the fall and winter is because one of the reasons is because the flu virus is more stable in colder temperatures, and people also tend to stay indoors in the fall and winter because of the colder weather. And when more people are indoors, then that allows a greater transmission of flu virus. Well, we could see the same kind of thing happening with coronavirus. And if we have flu virus floating around and we have this coronavirus floating around at the same time, that can be a cause for concern in terms of hospital capacity and a number of patients that are treated in the hospital because of flu and coronavirus. So definitely they're gearing up for the fall and winter, and they're anticipating a second wave that could be maybe more severe than what we currently are seeing. Again, we want to emphasize that no one really knows for sure. These are all projections. I would say my own personal feeling is, yeah, we will see a second wave of disease in the fall and winter. But it doesn't mean that for sure that will happen. Again, Allah subhanahu wa ta'ala has power over all things. And as I mentioned before, people were very concerned about Zika virus about 3 years ago when it came onto the scene worldwide. And after a year or so, it was no longer a cause for concern. So or cause for great concern. So even though that virus was transmitted not in a respiratory way, and it was transmitted through the blood, and this virus is much more contagious, and by people just coughing and sneezing and even just breathing or talking, it doesn't mean that for sure that this disease will be around for another 18 months or 2 years. Although I would say right now it looks that way, but we could also be wrong. Only Allah knows for sure. And I would always remind people to never stop asking Allah for help to make this go away and to help all the people that are suffering. So as I close, we always remind everyone, again, remember to stay at home as much as possible. The shelter in place order in Virginia is still there. Socially distanced, to stay a distance of 6 feet or more away from everyone else, especially when you're out. Wear the face cloth covering. Wash your hands with soap and water for 20 seconds. Avoid touching your eyes, nose, and mouth. Isolate yourself if you have symptoms of COVID-19, and quarantine yourself if you've come into contact or been exposed with someone who has COVID-19. So that's it. Jazakallah khair.
Barakallah, Dr. Zubair. Inshallah. I have 3 questions. The first one, it says, when should we expect the lockdown to be lifted in our area?
Well, again, whatever the state does, in other words, whatever the governor of this state, Virginia, does, Fairfax County will follow suit. And if you recall last week, we went over briefly the unveiling of the governor's blueprint to reopen Virginia. Again, what they're going to need to see is a 14-day downward trend of cases. And until that happens, there is going to be no reopening. But the phase 1 reopening is contingent upon that. So until that happens, we're not going to see any sort of easing of restrictions.
The second question, it says, when will testing be available for the general public?
Okay, by testing, I assume that the person means like diagnostic testing, seeing if you have an active infection of coronavirus. I don't have an answer to that question. I really can't even speculate, really. What I can tell you is that still nationwide, there are not enough tests for people who need to get tested. So that is still the situation, and they're still trying to accommodate as many people as possible. But to have testing available for the general population, I don't think that we are at a capacity to do that right now, and I don't think that we will be at a capacity to do that anytime soon. But let's see what happens.
Okay, I think the third question was, would it be a second wave? You already commented on that. And the other question here, how should we handle groups like Open the State? Well, that's a political thing, I think. Would their actions make the numbers worse?
Yeah, it could be that, we have to wait and see. Let's hope that we're wrong. But, it's anticipated any time that you reopen that there's going to be an increased number of cases. When you have an increased number of cases, that's also likely to be followed by increased number of deaths. So pretty much every place that is reopened, like Singapore and other places like Hong Kong, when they reopened, they saw an uptick in the number of cases. So these states that are doing that, it's expected that there will be an increased number of cases. Hopefully, they have infrastructure, public health infrastructure in place where they have enough workers that can do the contact tracing, meaning that as you see a number of cases increase, you can quickly identify those cases, isolate those people, quarantine the people they came into contact with, and hopefully put out any further spread. So is that infrastructure in place in many of these states that are opening? I don't think so. But let's see what happens. I mean, again, it's all guesses, but it certainly is cause for concern.
We want to emphasize the lockdown. When we say it's lifted, it's no longer that like we're going back to what we were. What would be? Can you explain to our community what is the new normal would be like if things had been, let's say, with the stages lifted?
Remember, according to the president, that there's a 3-phase easing of restrictions. So it shifts to phase 1, and then if there's continued downward trend of cases, they move to phase 2, and then onward to phase 3. So phase 1 is just looking at certain people going back to work, opening up places like barbershops or hair salons. It doesn't necessarily mean that everyone will be resuming their life as restaurants. But even if restaurants open, they'll be limited in terms of number of people that they can cater to. And of course, there'll be social distancing in place. And you're exactly right. This notion that even if restrictions are eased, that you're somehow going back to the life that we had before. Again, the answer is absolutely not. It's going to be, again, everyone's going to be doing the social distancing, wearing masks. That's the way I anticipate life will be for quite some time. I mean, like the rest of this year and going on into next year, perhaps.
Jazakallah khair. I have another question, and I think you commented on this in the previously, but maybe how soon can we expect a vaccine?
Yeah, the whole thing with the vaccine again is that they say 18 months, right? But as I've said before, 18 months is if everything is perfect. Sometimes it takes years to develop a vaccine. Maybe it takes a decade or more to develop a vaccine. Under perfect conditions, we can have a vaccine in 18 months. The other thing with the vaccine is, will we be able to produce enough in a very short period of time to disseminate to the whole, because everyone will need to get the vaccine. So Dr. Fauci thinks that it's possible to have that type of ramp up by January. But again, the question is also, will a vaccine be tested and be proven effective by January? I think that's optimistic, because also we mentioned last week how we are starting to see that there are many mutations or different strains of the virus, even affecting its ability to infect human cells in certain cases, like some strains are more aggressive than others. And if these changes keep on happening, that makes the task of developing an effective vaccine, which is effective for all different types of strains of coronavirus, more difficult. But what I will say is that it's not as bad as developing a vaccine for flu, right? Like, we don't have a universal flu vaccine, right? We have to keep updating the flu vaccine every year. Will it be like that for this coronavirus? I don't think so, because again, flu viruses have the capacity to change and mutate into other strains much more easily and much more drastically than coronaviruses. So it's cautious optimism. For those people who are checking their calendar or looking at the clock and 18 months is over and bam, we're going to have a vaccine, I don't think people should look at it that way.
You're right. You know, there's so many reports out there, and I wanted us not to really kind of get carried out with this. I mean, there's some reports came from Europe and from here that the vaccine may be available by September or October or something of that nature. But for now, we have to realize that there's no vaccine and there is no effective treatment. And the only thing that we have is ourselves to prevent, to do a prevention. And the social distancing is number one, and that's what we have to emphasize, at least for now. That's what we have in our hand, correct?
Absolutely. I'm glad you mentioned it that way. I'm glad you mentioned that. That is exactly the public health stance. That is the stance of the Fairfax County Health Department, that despite all this good work that's being done in research and development of drugs and vaccines, the bottom line is, as you said, there is no effective treatment for coronavirus. There is no vaccine that can prevent coronavirus, and it doesn't look like there will be for some time. So the best thing that we all can do, the things that are in our control, is to socially distance, stay at home, isolation, quarantine, cover coughs and sneezes, wash hands, avoid touching your face, things like that. We need to keep doing that, and those things are having an effect. As I'm looking at the graph and the curve, which, by the way, anyone can go to the Fairfax County Health Department website and you can look at it yourself. They have a graph that very clearly is showing that the curve is bending. In the past few weeks, it's bending. So what we're doing with all of these measures, mitigation measures, it's working, and we need to continue to do that. Otherwise, we'll still see a drastic number of cases.
Okay, Barakallah Feek, Dr. Zubair, and I thank you so much for being with us, and we appreciate always you come to our community, and hopefully we can see you next week, inshallah, so we'll get an update on that. So at the end, we, on behalf of all our community here, we thank Dr. Zubair for his time and for his advice. And we ask Allah subhanahu wa ta'ala to keep us all safe. And we, as you heard Dr. Zubair says, we all have to do our part. Don't take things lightly. We have to do our duty by prevent the spread of this disease and take it seriously all the times and not loosen up until we have an effective treatment and or vaccine. And we ask Allah subhanahu wa ta'ala to make this happen to us and to protect us all. So at the end, we ask Allah subhanahu wa ta'ala to forgive us all and to accept our siyam and our qiyam and make us and accept all our good deeds and make us do what we do purely to please Him and Him alone. اللهم ارزقنا الإخلاص في العمل. ربنا تقبل منا إنك أنت السميع العليم وتب علينا إنك أنت التواب الرحيم وآخر دعوانا الحمد لله رب العالمين وصلى الله على نبينا محمد وعلى آله وصحبه أجمعين وجزاكم الله خيرا. And we'll meet next week بإذن الله, Allah's willing. Assalamu alaikum.